Welcome back. You're still watching The Morning Show on this Think Tank Tuesday. Thank you so much for staying with us. Now, the diagnosis and treatment of hair loss, otherwise known as alopecia, happens when we gradually lose hair, causing patches of baldness over the scalp in both men and women. And many people suffer from this condition. And here to give us more insight is Dermatologist Dr Claudia Moloabi. Doctor, a very good morning to you. Thank you so much for joining us on The Morning Show. I think one of the things, Doctor, that I want us to start with is just understanding how common this condition is, because we did say in the opening that this has got to do with hair loss and it affects both men and women. But how common is it?
Good morning, Nelly, the producers and the viewers. Nelly, the hair loss or alopecia is very common. It affects both sexes, and then children and older people. It does not have a predilection for men and women, even children.
Sure. And when we're looking at the causes, Doc, what would you say are some of the causes of this condition?
The causes we say is multifactorial. It ranges from genetics, autoimmune, systemic diseases, hormonal, infections, malignancies, and the treatments that we use generally in dermatology and in other disciplines of medicine.
Sure. And when you are looking at your patients, do people come with you, Doc, maybe with some early signs? Are there any signs that I can pick up and probably come to you with those kinds of concerns? If maybe I have an itchy scalp or I see a bit of scarring on my scalp, what are those some of those signs that people should look out for?
Like you rightfully also included, the itchiness of the scalp. The scaliness, like you look like it's dandruff-like. At times it's not really dandruff. The scaliness and the dryness. And if you just comb your hair and then there's so much of hair coming out, you should start thinking that there should be some hair loss condition going on.
And this does not only happen on the hair that we see on our heads, right, Doc? It can affect other parts of the body.
Absolutely. Like I always explain to patients that alopecia is hair loss in one or more or all hair-bearing areas, meaning it can be on the scalp, it can be on the eyebrows, it can be on the axilla, it can be in the pubic area, and even generally on the body, arms and legs.
And usually, Doc, people will speak about the fact that, you know, prevention is better than cure. So is there a way of preventing alopecia? Can I do something in terms of my diet to make sure that I am not affected?
In terms of the causes, other causes like the infections and the systemic diseases, at least something can be done. If you know that you have a condition like maybe, let me say, the thyroid diseases, some of the signs will be the hair loss. So if you know about the systemic disease or the infections, you consult earlier on, then at least the dermatologist will be able to advise on the hair care itself. The hair care is very, very important, like meaning that using the correct hair care products, because most patients come in and they are using, some of them are using correct hair products but wrong for what they have.
Right.
I'm not sure whether you know, like a patient will be coming with an autoimmune kind of disease of hair loss, but they are using treatment or shampoos that are targeting infections like the fungal infection, because somebody told them this is fungal.
And I suppose then that makes it very important for anybody who probably has suspicions that they could have alopecia to be able to go to a professional. Because I see a lot of people who are on different Facebook pages, for instance, who are asking for advice from other Facebook users, and a person will tell them what worked for them, as opposed to what could probably work for whatever condition that they have and some of the signs and symptoms that they have.
Absolutely. That is exactly what I always tell patients, that when they come to you, they already have ideas where they got it from somewhere, that such and such a person said they use this. And when you come to see, it's not exactly what that person has. And then they will tell you, mix some other things and all those. And I always tell patients, there's nothing that you can get over the counter that will treat hair, especially if the autoimmune and genetics, and even those malignancies. You need to consult a dermatologist, usually, actually more a dermatologist, because we are trained to see the signs. Even before we do the investigations, we know that this is possibly this type of hair loss, but we don't even end there. We take a biopsy, which will tell us what are the cells that are there. And then when we treat the hair loss, we don't just treat like to encourage hair growth. We treat what are the predominant cells using the therapeutics that we know that will target the cells. Then we know that the hair loss will stop. And then the other patient will say, I think I need a hair transplant, coming to a dermatologist already asking for a hair transplant. And I tell them, not all hair losses are it needs to be hair transplanted. Because if you transplant the hair that is on the diseased scalp, then you actually are wasting money, because that diseased scalp, they will cause hair loss, and you lose all that hair. You've lost all your money. So at least get a diagnosis, and at least the advice on, well, this is the kind of hair loss, and these are the cells that are predominant, and whether there is a scar, meaning that with a scar, we are more going to use something that will also treat the scar before we encourage the hair growth. We don't just do it for each and every patient. Like I always say to patients, it's not one size fits all.
Yes, yes.
We individualize patients according to what we see, and dermoscopically and even on the biopsy.
Doc, thank you so much.
And also look at the patient in all.